Usually it feels like my lungs are swelling up.
In North Carolina, it's just about 10%. It's almost at the national average. However, in eastern North Carolina, it varies from county to county, but there are certain counties that actually have higher prevalence of asthma than the state and the national rates. Most of these counties are rural, they're impoverished, they have a lot of children, and they're predominantly African American.
It is a chronic condition that involves the lungs. It causes muscles in our lungs to swell and shake, as well as the inside of our lungs to swell, and causes us to produce a lot of mucus.
No one actually knows what causes asthma, and there is no cure. But one thing the experts agree on is that it is a combination of genetics and environment. And so we can't really control our genetics, but one thing we can do is we can control our environmental exposures. And so with a person that has asthma, controlling the environmental triggers is really key.
One of the most common ones is airway infections, so your colds and your flus. So we do recommend all asthmatics get the flu shot every year, not the nasal spray, but the flu shot. Another one would be animal dander, or the saliva or feces from animals and stuff. So thank goodness we don't have animals in the classroom anymore. Other things can be strong fumes and odors like perfumes, colognes, potpourris, incense, and candles. Weather changes is a big one. So on those cold days, we're asking the teachers to make sure that the kids that have asthma to put their coats on, zip it up. Hot weather can be a problem as well. What we ask them not to do is just bolt outside, start playing hard and fast. Walk around for the first 5 or 10 minutes and give their body time to adjust to the heat and humidity that we have here in eastern North Carolina.
Sometimes a teacher may unknowingly have a trigger in the classroom. It may be from a custodian's chemicals that they may be using to clean the floor. It may be from carpet that may be soiled or may be off-gassing. It could be a variety of things in the classroom that may be causing the asthma trigger. So usually when someone has an asthma attack, one of the things that we like to describe is sucking through a straw. So if you suck through a regular McDonald's straw, you can breathe through it pretty easily. But if you took one of the coffee stirrers and you tried to breathe through it, you would notice that it's much more difficult to inhale. It's kind of like a fish without water.
Watery eyes, runny nose, it can be a little bit of shortness of breath, so it can be very mild symptoms, almost like a cold, but then it can get very severe. So when we talk about severe, we're talking about somebody having lots of shortness of breath, very loud wheezing, which is a whistle sound when they're breathing out. They can have retractions, so they're using a lot of extra muscles, especially in the neck area and around the ribs to breathe. And nasal flaring, their nose will be flaring out when they're trying to breathe in. And the last thing that will happen, which we do not like to see, is their lips and fingernails will turn gray or blue. And that's definitely a 911 call.
The asthma action plan is a plan for the teachers to actually go through. There's a green light, yellow light, and red light. And what it does, it gives you signs and symptoms of what they're going through, if they're just having wheezing, or if they're having shortness of breath, or if they're really in trouble in the red zone. And it actually steps the teachers through what they need to, how many puffs they need to give to the students.
It's just like a stoplight. So if we're at a stoplight and it's green, we go. So that means our asthma's doing good. We can go and do just like anybody else. In the yellow, we should slow down, caution. That's when we're having our early warning signs and symptoms of asthma. That #1 symptom being that aggravating tickly cough. Red zone, stop, it's an emergency, and that's when we're having those late warning signs and symptoms of asthma. The biggest one being lots of coughing and loud wheezing. The medications that we commonly see at school that is not needed at school is called QVAR, QVAR. It needs to stay at home. That's a control of medicine. The ones that they need to be familiar with are the ones we call rescue medications. The most common name that we use and hear a lot is albuterol, but there are several other names that can be called: Proventil, ProAir, Ventolin, and Xopenex. They need an asthma action plan, they need authorization med form, but then a spacer device like this one right here they can get from the school nurse. So whether it's a mouthpiece or a mask, again, they can get those from the school nurse. And then the last, most important piece is they need to have the rescue medication with them. Put your inhaler in, your spacer, and we're going to do your mask one since your breathing's a little bit hard right now, okay? I'm going to hold your back here, squirt, deep breath in and out for me 5 times. Blow out. Another one in and out. Again for me. You're doing great. And 2 more times. There's 1 and 2. Good job, Gracie. Shake. Prime it. I'm going to put it in the very back where it belongs. I'm going to let you put it in your mouth. Squirt it 1 time. Take in a really, really good deep breath. Hold that breath in for a count of 10. You ready? All right, I'm gonna hold it. I'm gonna let you hold it. And squirt. Deep breath in. Now hold it to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good job.
Education is a really key ingredient for controlling asthma.
Biggest thing is stay calm, because if they show that fright on their face and in their eyes, the kid's going to be scared. If they do start having some of these signs and symptoms of asthma, especially early on, go ahead and pull the child off to the side and use their albuterol medicine, using their spacer, so that we can get their asthma under control. During the asthma episode, the biggest thing we want them to remember is REACH. Rescue medicine, equipment, which is their spacer device, asthma action plan, and call for help. They are not alone.